Okay, and just so I know who we have on the line here this morning, I see a wonderful name that I don't recognize, so I just want to check in and see who additionally we have joining us. So could I put Sarah Berry on the spot?
Yes, I work for Senator Brad Pfaff.
Wonderful. Thank you so much for joining us, Sarah. Great. Thank you. All right, and with 9 o'clock, we'll go ahead and begin. So thank you all so much for joining us for this morning's event. For new legislators and staff, welcome to the world of health centers. Just again, a few quick housekeeping items as we get started here. You are all nicely muted. Thank you so much for doing that. And you can go ahead and mute and unmute yourself for questions or comments. Though we will save those generally for the end of presentations here today to make sure we get through everyone. The chat function is also available, so if you have questions and comments that are burning, you can go ahead and add those. We are recording this morning's event and we'll be sharing it with both attendees as well as with legislators and staff who weren't able to attend today. Hopefully that doesn't dissuade you from asking questions of our health center colleagues here, but we know that this will be a great resource as a presentation, so do want to record that. Slides and the presentation itself will be shared this morning, along with contact information for all of the presenters. So we'll be happy to provide all of that information for you. So with housekeeping checked off the list, I'll go ahead and begin here. So I'm Rochelle Andre. I am the Government Relations Specialist with the Wisconsin Primary Healthcare Association, also known as WPHCA, if you're not familiar with us already. I take lead on executing our advocacy efforts here at the state and the federal levels, and we're really excited to have all of you here joining us today. So as we begin here, let me just advance my slides. Great. So what will we be covering? We'll do a brief round of introductions. I will indeed ask attendees to give some introductions for us today, so just letting you know about that. But we'll spend the most of our time here today really turning it over to health centers. We have 7 health center staff who will be presenting information about their organizations that we are thrilled to learn more about. And then we'll have a little bit of time for questions as well as share some additional resources as well. So I'll begin just with a few introductions from WPHCA staff. So again, you know who I am now. I'll ask Sashi Gregory and Carly Meyer to both wave. They're also part of our external relations team. And then Tony Langenall is with us as well. He helps us with our advocacy efforts in the Capitol too. So Tony, if you'd wave for us this morning. Thank you. And then we do have a handful of health centers. I'll ask them to introduce themselves when they present, but just so that we have a sense of who's on the line today and make sure we don't miss you, let me ask Representative Rachel Cabral-Guevara, or RCG, to do a brief introduction today. So if you could let us know your name, what area you represent, and if you have any specific questions you'd like to see us address about health centers, please just flag those for us as well. And I'll ask everyone to do that this morning. Thank you so much.
Gotcha. So Rachel Cabral-Guevara is who I happen to be. I represent the 55th State Assembly District, which is Neenah, Appleton area, up by the airport, by the Fox River Mall. So further north, I am a nurse practitioner, and I have worked at some health centers throughout Wisconsin. La Clinica, I do migrant camps in the summer the last few years, which has been an awesome experience. And then I've also worked at Partnership, which used to be Fox Cities Community Health Center in Appleton. My main areas of focus happen to be healthcare, mental health, universities and colleges. I did work at UW-Oshkosh in the College of Nursing for 13 years. Excited to be here. I am new to this role, right? Never had for anything before, so learning really, really quick. But healthcare, mental health, and then universities and colleges seem to be my biggest focus for the session that I will be holding this seat for. So thank you.
Thank you so much for joining us. You may have a little bit more of a baseline understanding about health centers than not a lot of new legislators, so that's very exciting, and we're happy to have you this morning. Thanks so much. So I'm just going to go through my little Zoom grid here.
It was wonderful to have that experience, so thank you.
Good. So happy to hear that. Thank you. So let me ask Stephanie Bishop if you would mind just sharing Oh no, you're one of our presenters. Pardon me. I'm so sorry. Sarah Berry next, the office you work for, and any special questions you may have for us today. Thank you.
I am Sarah Berry. I am the Chief of Staff to Senator Brad Pfaff, and I think our FQHCs are incredibly important, and I'm just happy to be here.
Thank you, Sarah. And I see that Senator Royce is with us today. Could I ask you to do a quick intro, where you represent, and any questions you have regarding health centers that we could address?
Sure. I represent most of the city of Madison, and healthcare is a passion of mine, so just excited to be here.
Thank you very much for joining us. And Senator golly, I'm going to mess this one up already. Pfaff, quick introduction for you if you would.
Well, good morning. My name is Brad Pfaff, and I represent western Wisconsin counties of La Crosse, Vernon, Crawford, and southern Monroe. We have a healthcare clinic here in Cashton that does tremendous work on behalf of a very diverse rural community. I am excited to participate here and learn today. And I want to thank Sarah Berry from my team for also joining. And please, at any time, anybody on this call, reach out to me and my team, and we welcome to partner with you to provide healthcare to the people of Wisconsin. So thank you.
Thank you so much, Senator Pfaff. All right, I see we have Representative Conley joining us today. A quick introduction, any questions you may have for us?
Good morning. I am Sue Conley. I represent the 44th District, which is basically the city of Janesville. I did a small stint as an interim executive director at HealthNet here in town, which is a free and reduced clinic. So I have a little bit of knowledge, but I'm excited to learn everything that you have to share today. Thanks for inviting me.
Thank you, and thanks for the note on the free and charitable clinic there. Great. Representative Snodgrass, thanks so much for joining us. Quick intro, any questions you may have?
Good morning. I represent the 57th Assembly District, which is here in the Fox Valley, central and southern part of Appleton, Menasha, and village of Fox Crossing. Don't have any questions, but I'm the daughter of a registered nurse, so healthcare has always been an important part of my family's life, and I look forward to learning from you today. Thank you.
Thank you. And Matt Pold, I see you're on the line as well. Quick intro from you.
Michelle, it sounds like Matt does not have microphone this morning.
Oh, very good.
That was in the chat.
Okay, thanks so much for the note, Joe. Appreciate that. Wonderful, Matt. We're happy to have you. And let's see, Matthias, a quick introduction from you.
Hi, I'm Matthias Google. I am the Health Policy Advisor for Senator Julian Bradley. I have previously been the Health Committee Clerk in the Senate, working with Leah Buchmeier, so most of my health knowledge comes through those venues, and I'm happy to be with you to learn a little bit more today.
Thank you so much. And then just wrapping up, I see that we have Representative Sarah Rodriguez with us today. Quick intro and any questions you may have.
I am trying to get my video up and going.
You're doing great. You're halfway there. Perfect.
Yeah, so Representative Sarah Rodriguez, I represent District 13. That's just some of the Milwaukee and some of those western suburbs, Brookfield, Wauwatosa, West Dallas, Elm Grove. I'm also a registered nurse and worked for a very, very long time within public health.
Thank you for joining us. Mary Jane Boehm.
She also wrote in the chat.
Oh, goodness. Thank you, Sarah. And then see you waving. Happy to have you. And of course, you have questions or comments, you can throw those into the chat for us. Thank you so much for joining us, Mary Jane. And then finally, Representative Andraka, quick intro if you're able. Great. I am sure you were listening in. We will provide more information for you. We're happy to have you here today. Very good. Okay, did I miss anyone? If so, wave for me and I'll try to grab you. All right, then we're diving in. Thanks so much. So I will give us a very brief overview of health centers and WPHCA, but we're going to spend most of our time with the actual health center presenters today. So excellent. What are community health centers? We get a lot of questions. Are you free and charitable clinics? Are you hospitals? None of the above. So when we talk about community health centers here on this call today, we're talking about a really specific type of entity, a federally qualified health center, also known as a community health center or just health centers. And health centers provide primary and preventative care services that includes medical, dental, behavioral health, and all kinds of other services, such as signing folks up for different benefits as well. What we get most excited about with health centers is that they provide care to patients regardless of their insurance status, regardless of their ability to pay. So if someone is uninsured, they may be assessed a fee for their visit of $5 or $10 on a sliding fee scale, but the same care is provided to everyone regardless of whether they have Medicaid or no insurance or use private pay. Health centers are private or public, not-for-profit organizations. To set up a health center and get a federally qualified health center designation, there needs to be a high-need community in that location or serving a high-need community. And we are always excited to share that health centers are governed by a patient majority board. So the patients really are the bosses of these institutions. And then finally, they report publicly on many performance requirements and financial data as well. So a lot of transparency elements there too. Health centers serve primarily adults, also provide care for children. In 2019, health centers served over 300,000 patients here in Wisconsin alone. Some health centers provide care for special populations such as veterans or individuals experiencing homelessness. Many health centers partner with schools and actually provide care in those locations as well, which you'll hear more about today. Health centers serve primarily patients living in poverty. Most patients have an income at or below 100% of the federal poverty level, which was $26,000 for a family of 4 in 2019. Health centers do bill insurers. For example, most health center patients are on Medicaid. Many are uninsured, but some health center patients do pay with private insurance as well. All this information is again publicly available. I can give you a lot more data about health center patients if you'd like at a later date. And just so you know where we are, there are 17 community health centers across Wisconsin. Most of them have multiple service locations. So this map just gives you a sense of where health centers are. And if you need more details about where clinic locations are near you, we can certainly follow up with that, but this gives you a good sense of where they are. Oftentimes health centers see patients that travel across county lines or even across a region to get their care, as they may be the only location that provides care for uninsured or underinsured patients or Medicaid patients in the area. So just a quick background on WPHCA. We are the member association for those 17 health centers in Wisconsin. We exist to serve them and their patients. So we provide training and technical assistance, convene forums, and then as you are involved with today, we also advance strategic priorities such as our legislative agenda. So with that, I'm just going to turn it right over to our health center showcase. I asked health centers to each share where they serve, any special populations, and kind of fun programs that may pique your interest and may need some follow-up later. So with that, I will ask Chris Rosh with 16th Street Community Health Center to begin. Thanks so much, Chris.
Great. Well, good morning, everyone, and thanks for being here. I'm Chris Mamby-Rosh. I'm the Director of Strategic Partnerships and Government Relations for 16th Street. I've been here for 4 years and also worked at the Wisconsin Medical Society for a long time. So 16th Street, we have a bunch of locations all throughout Waukesha and Milwaukee. So over a dozen locations, but we have 4 main ones currently, with 3 being in Milwaukee and 1 being in Waukesha. So very excited about that, to be able to provide services throughout the general greater Milwaukee area. One thing I wanted to point out is, we do offer a full service medical clinic at those main sites, but we also offer full services around behavioral health. So including alcohol and other drug, as well as medication assisted treatment for those with opioid addiction, both at our Waukesha clinic and our Layton clinic in Milwaukee. So we've been excited to be nimble and respond to the growing opioid epidemic that's been going on in the state and has really worsened since COVID has hit in the pandemic. We're excited to announce that we're actually expanding that work with our upcoming clinic at National Avenue, which is opening next month, where we have a really amazing partnership with Milwaukee County Behavioral Health Department Division of Mental Health, where we're going to have our regular traditional behavioral health services, but we'll also be expanding that to substance use services and medication assisted treatment and crisis services and same day appointments. So so it's not the first one, but it's very unique both in the state and in the country when you think about that partnership with Milwaukee County. And certainly it's going to be a very robust program. There'll be about 25 Milwaukee County staff located out of that clinic, and there will be about 30 16th Street staff located out of that building. So we're excited to be opening that up. Also, we have 6 in-school clinics currently, and we're adding a new one at Cristo Rey High School starting in 2021. So we have both at Augustin Prep and at St. Anthony's schools full service clinics, medical clinics with actual prescribers and medical assistants embedded in those schools. And so there's no other health system that has anything like that. Some have nurses, but we have full-fledged medical programs, and that's a growing space for us. We've just added UCC Head Start, and we're looking to partner with other schools, both private and within MPS. There are discussions right now to do that. We also have a number of behavioral health schools at MPS schools at Lincoln, Dorfler, and Zablocki. And we're looking to expand that over the next year with them as well. So next slide. So we have our kind of traditional services around medical behavioral health, and we have a dental hygienist program. So thank you to the previous legislature a couple sessions back where they expanded the ability for dental hygienists to practice independently in new areas. And so 16th Street was one of the first ones in the state to take advantage of that and open up a independent dental hygienist program. So we have that up and running as well. But we have a very robust medical program that includes pediatrics, family medicine, internal medicine, with 55 medical providers. So, so it's a pretty robust program. Half of our patients are kids, and then half of our patients, the other half are adults. And on the behavioral health side, it's actually 52 behavioral health providers now that we have across the spectrum of providers, from psychiatrists to psychologists to licensed clinical social workers, licensed family marriage therapists. So we have everybody on the team that sees both kids and adults. And so when you think about the 52 behavioral health providers there, I think it probably makes us the largest provider of outpatient mental health for Medicaid and uninsured patients really in the state, or one of them for sure. And then we have the other part, we call it our magic sauce, the extra support and education that, I think health centers better than most have for a long time understood that the things that are going on in people's lives outside of the clinic are really driving their health. There's only so much you can do in that 15 to 30-minute appointment within the 4 walls of the clinic, that there are other environmental, social, behavioral factors that are driving their health. And so we've really built a robust program around that to keep them well. And I think just now other health systems are starting to catch up to that population-based health model. But we've been doing that along with others for a long time. Next slide. So here's our demographics. So we see over 43,000 patients with over 200,000 visits a year. So, so we're pretty large. Most of our folks are living under 100% of the federal poverty level. So you see 76% there. If you were to go below 200% of the federal poverty level, I think it's about 98% or so of our patients. So it is really folks who are poor. I would say they are the working poor because about 70% of our patients are working and are employed. And so it's just, they are working jobs that are for staffing agency, or they're working in the service industry and really don't have high incomes or insurance or affordable insurance that's being offered through their employers. So our clinic and our is really heavily focused on kids and women, with half of our patients being under the age of 18. And then if you look at our adults, 2/3 of our adult patients, so the remaining 20-some thousand of our adult patients are are women. So it's really a practice that's focused both on women and on kids. And we also have a WIC program, which I don't think I mentioned in the slides, which is the largest WIC program in the state of Wisconsin. So next slide. So wanted to just be sure to touch about COVID as well, because it is the issue of our time right now, and I'd be remiss if I didn't. And particularly given that the community that 16th Street serves on the south side of Milwaukee and Waukesha has been hit particularly hard by COVID. So fairly quickly, within a week, 16th Street was doing community-based testing. So we're very proud of the fact that we were able to pivot that quickly to be able to try and keep the community safer. So we have had a very robust testing program, and where we've tested over 17,000 people, done over 22,000 tests now at this point, with a positivity rate of about 30% on the tests we do. If you just look at the positivity rate of the people that we've tested, it's over 35%. And so that number is averaging out back from the beginning of the time, counting the high points and the low points. So, there's lots of stories about how high the numbers are right now in Wisconsin. I think it's like 22%. Well, we've averaged well over that for the entire time. So you can kind of see the ebbs and flows of what that looks like here on the chart on the left. And then you can see what that number looks like by zip code, which we have here. So we've tested folks in every zip code in Waukesha, every zip code in Milwaukee. We've even had on occasion a couple of visitors from out of state that are getting tested at our clinics. So right here you can see some of the highest numbers highlighted in orange. But even in communities like in Waukesha, 53188 here and the 53186 numbers, the numbers are at least 15% to 20% high on average since the beginning. So really high numbers even in those communities as well. And then we can't do this alone. So, there's been lots of support that we've gotten both from government and the philanthropic community. This tent on the right here, this is the administrator for HRSA, which is the Health Resources Services Administration. This is the previous administrator under the Trump administration who came to take a visit at one of our clinics, and this is our Safe Care tent. That was funded with CARES Act money, routes to recovery money that went to the state, that went to the local government, to the Milwaukee Health Department, then ultimately to 16th Street to help support this. So, so we're doing a lot of good work, but it's only in partnership and with support with our friends in government that we've been able to do a lot of it. So we thank you.
Thank you so much, Chris. Appreciate that presentation. We're just going to move right on through to Bridge. A. Lee, you're up. And I forgot to note earlier, we'll just save questions till the very end, just for the sake of time here. So of course, though, you're welcome to drop them into the chat so you don't forget them. But A. Lee, please.
All right, thank you for joining us today. We really do appreciate the support and the partnership that you have provided for the community health centers in the years and the decades past. And we hope to work with you more in the future to partnership in healthcare access. My name is Ailey Hurt. I'm the Community Outreach Coordinator here at Bridge Clinic. We are based in Wausau as our main office, where we provide more comprehensive services with medical, dental, and behavioral health. And we also have dental-only sites up in Merrill and Anago. And of course, you can see in our region here that we provide services in the north, central, northeastern region area. And like mentioned before, this does not limit our boundaries from where patients come from. They come from pretty much anywhere in the state. And we will sometimes work with each other and the CHC borders on, who can we provide help with if you are too far over there. And that's been just a great partnership within the health centers. Besides the service that we do with direct care, we also provide resource navigation and CAC services in regards with Medicaid enrollment or marketplace enrollment too with our application counselors. And we also provide services that family might have need. Again, going back with resource navigation is that they might come in and need food help or housing assistance or clothing. We provide that service to them too. And it's just a whole healthcare instead of just the medical provided service that we do here. On average, we see about a pretty good amount of patients, but we want to talk about history, where we came from. Bridge has been here since 1995, and it was a startup of the influx of the Asian population that came to Wausau. And a lot of providers wanted to make sure that we have that community served, but also to make sure that our current communities are being served as well. So that's where we decided to establish Bridge Clinic here in Wausau because of that population. Unfortunately, last year we did not get to celebrate our 25th anniversary. So we hope that in the next coming years we can get the community involved and help us in celebrate how far we came in health center services in the area here. Next slide. Patient-wise, we see about 7,000 patients each year on average, and about 21,000 visits per year. The majority of our patients are actually 25 to 69 years old. As you can see there too, about 81% are below 100% FPL. So in a rural area, we can expect those numbers to change in that sense. In a more urban area, numbers tend to change a little bit too as well. But we work with a lot of non-English speaking patients in the area here. And that's why we provide Hmong interpretation service and Spanish interpretation service on site. And I think our interpreters do a great job with being well known in the community, but also well connected. And a lot of patients have a lot of confidence and comfort when they come to see our providers. So about 13% of our patients are Asian, about 9% are non-English speaking. So I think the service that we provide here really provide a home care for those that may not have access elsewhere. And you can also see that we do work with the veterans as well too here, and work closely with the Marathon County Services, health services, to make sure that we do provide the service that they otherwise might not have access to in the area here. Next. So besides healthcare, and we do a lot of things outside of our borders here, and this is a community garden. We provide 3 community garden sites to our community, and many of our gardeners are actually our patients. And this is a great opportunity for us to teach them about healthy eating. You know, how do you prepare what you've grown in the garden and get that on the table in a healthy way? So we do a lot of health education on food preparation. We do a lot of organic growing in the gardens, and we do a lot of kids classes too as well. And as you can see, there are beekeepers. We have honeybees in our gardens too as well. And each year we average about 80 to 96 ounce bottles that we sell out to the community. And that just helps to get us connected and get the community connected to us. And we know how essential it is to get localized honey from nature. So it's really helpful just to have that too. And most of our renters, again, are our patients too. So we really do connect them with the healthcare part of it, and then how do we work with them on the nutrition part of it. Next. Counseling services wise, we founded a school-based counseling consortium about 3-4 years ago. And this is a really great start for us, because the school has been asking, you know, we used to have school counselors at the schools, but they have changed that since in decades. And so the school wanted to have provide counseling service in the school. So we work with 10 organizations that cover all of Marathon County school districts. And right now we are in 4 of the schools, but we have the whole county covered, which is a great service to all the school districts. And we have heard that surrounding counties are looking at us and how do we make it work? And we hope that other counties will follow. I think it is a great service to our population, our communities, and our schools. But we are a resource to those surrounding organizations or communities and counties that want to have this service too as well. I will just touch base on that quickly only. Next slide. Of course, I think, again, like Chris said, we had to talk about COVID too. And health centers are working with ever-changing environments from pandemics like this too, and we adjust very quickly to it. Our patients have a very unique need, and some have a very lacking access to services that are very essential and basic. And health centers like Bridge Clinic, we really stepped up and do what we can with the limited resource that we may have, and to really make sure that our patients are well versed in what's going on in the healthcare area in regards to COVID. We make sure that they are tested. We have testing ability too as well, and we will be a vaccination site as well. Unfortunately, we have not received our vaccines yet, so we hope to get it soon to get that started as well. but our patients really do feel comfortable that we are providing the necessary information to them. And we do a lot of education on, what are some facts and myths about COVID and vaccinations to really make sure that our staff and our patients are educated on what we can and cannot do with the healthcare that we are facing now. But otherwise, Bridge Clinic, we continue to change, we continue to evolve and continue to meet the needs of our community. And we certainly will help, we used to help our legislators too as well, to be our partners in healthcare. So we really do appreciate you being here today. So thank you very much.
Thank you so much, Ailey. I'm sure we could spend a whole additional presentation on talking about COVID and vaccination. So if there are questions on these issues, we'll follow up with you as well.
In 5 minutes, it's very hard to talk about the clinic.
I know, I put everyone sort of an impossible task today. So thanks for trying to meet that.
Thank you.
Next up, we have Lisa Killowy with Family Health Clinica. Lisa?
Good morning. I'm really excited to be with you this morning. We also have Laura, if you could just wave, our CEO, Laura Wald-Vogel. I think that one of the important things to start out with, if we can go to the next slide, is to remind you that all of you are FHLC representatives because we are the only federally funded migrant health center in Wisconsin. So the entire state of Wisconsin is our service area. A bit about our specific locations. Our main flagship site is in Wautoma in Washera County, where we have primary medical, dental, behavioral health, substance abuse and recovery. We also provide WIC services out of that facility. We have standalone dental services in Mauston, as well as Beaver Dam and Stevens Point. We also have a behavioral health and substance abuse facility in Adams County in Friendship. Our mobile health center, again, is statewide, and this year with our COVID services, we served over 23. We actually went out to 23 different counties, and we expect to go out to additional counties this year. Next slide, please. All 5 locations serve our main community health center service areas in central Wisconsin, and I won't read off all of the counties, but Portage, Wapaka, etc., all the way down to Dodge. Our mobile health center serves a very vulnerable population. We were really excited that, based, I hope, on some of our feedback, as well as our partners that will work with the migrant population, that the farm worker population has been included in the Group 1B for COVID vaccinations. We had a large, as I mentioned, COVID risk mitigation project that was a partnership with the state, as well as utilized MCW grant funding, where we tested, as a part of screening, over 3,000 migrant workers. We really feel that we were instrumental in kind of averting a lot of outbreaks in this population. We served in 2020 over 18,000 patients, and we're seeing that grow. COVID and the economy has really it's been really challenging times in central Wisconsin. Special populations, in addition to the migrant workers, we also, around the Dalton area, serve in the Amish community. Next slide, please. A little bit more about our COVID risk mitigation project for the migrant and seasonal workers. It started back in April. Sadly, we thought that the pandemic would be over surely by now. Everyone knows that that is not the case. So we are ramping up. We are also ramping up to try to, and we'll be providing vaccinations to this population too. And as you can imagine, delivering vaccines to the general population is difficult, but we are excited, and we know that we can do it at our clinic already. We have in the upcoming weeks over 200 people of our patients, mostly that meet that 65 and over patients. So we're hoping that the supply comes through. All services to migrant workers are provided free of charge, mostly free of charge. We again, over, I think now we're up to 25 different counties. We had over 307 different missions, we were calling them. We also have our, without COVID, we provide primary care services via our, you can kind of see it in this picture here, stated we are fortunate enough to be able to purchase 2 years ago a state-of-the-art mobile clinic where we can provide medical and dental services. I think that is all of my slides, or next slide, right?
That is all from you today, Lisa. Thank you so much for joining us, and really amazing creative programs from La Clinica. Thank you. All right, next up we have Access, so I'll turn it over to Joanne Holland. Joanne?
Oh, thank you, Rochelle. I appreciate that. So good morning, everyone. I'm the Chief Financial Officer at Access, and we became a federally qualified health center in the early 2000s. But for folks who have a little more knowledge about the Madison area, we used to be the little red house on Willie Street before we had the federal designation. And a really important part of how we were able to get that designation for our community was, as Rochelle had said before, it's about what are the needs in that community. And one of the things that was really significant here as an unmet need was dental. So you'll see that that's a big part of our presence in terms of the work we do. When we look at our service lines, about half of what we do is medical and behavioral health, and the other half is dental. And so a big part of our efforts in the South Central part of the state, and I wish I had a picture here, it'd be really neat for all of you to see this, between all of our health centers, we really cover the entire state, which is, I think, a really beautiful part of the health center story, is that we're not here to compete. We're here to partner and to work together and to meet the needs of our respective communities. Access is based out of Madison and Dane County, and then in the 6 or 8 surrounding counties that are contiguous all the way down to Grant County in southwestern Wisconsin. That's where we're really trying to meet those needs and thinking about how we can do our work effectively in those communities. Another piece that I wanted to point out too is that we also have an affiliation with a family practice residency with UW School of Medicine and Public Health. And that's really important in terms of, again, how do we connect with our community that's around us? And how do we also think about that pipeline of future providers? Because without the workforce, just as you've heard from all of my colleagues, without the workforce, it's really impossible for us to be successful in helping the people in our communities. Just a little bit of a thumbnail around Access. We serve about 30,000 patients on an annual basis. We employ about 250 people. Our annual budget's around 35 million, of which about 2/3 of that is through payroll and benefits. And that's something that we take very seriously in terms of the economic impact that we have in our communities, and helping to make sure that people have an excellent employer for whom they work, one they can rely on and depend on, so that we can be there for our patients. And I just wanted to note as well that during this past year, we've been able to keep our organization together. There certainly has been a lot of work for us to do. And we've been able to do all of this without layoffs, without furloughs, being able to be that consistent economic force for our employees and our communities. And that's something that's really, really important as we hear about the economic challenges. If we go to the next slide, just a few things to talk about in terms of 2020 and some of our initiatives. One is around, how have we adapted to and responded to the pandemic? The next slide, when we get to that, is going to be a little bit about what else, because the needs of our patients, the needs of our community are present and frankly have really been exacerbated by COVID. But just a few things, and I'm sure all of us have had to go through an adaptation process. We've really had to kind of turn ourselves inside out. You saw some great pictures from other places about what that might look like. But we've set up a separate respiratory care clinic. We really wanted to make sure that we could still be operating and still be there for our patients, but do so safely with an eye toward our staff and our patients. We've also adopted telehealth, which has been a very important part of us being accessible for our patients, but doing so again in a way that really promotes safety and frankly, productivity. And I think that that's a message that we just want to send to you as well as our legislators. Thank you. your support of a really high functioning Medicaid program has helped us to be adaptive, has helped us to be able to be there for our patients and to use technology to make that happen. And that's something that is just so critical to the work that we do on an ongoing basis. We also wanted to talk about, this too as a business. It's important that we're good stewards. And so we've actually been able to take the pandemic and what it's forced on us to be able to look at how can we do our work and be more productive? How can we be more agile? How can we ultimately be there for our patients, but also run a business knowing that there's so much uncertainty? And so if we transition to the next slide, I think that that's a really important part of thinking, not just being narrowly focused with regard to COVID, but also being thoughtful about how do we make sure that we don't fall behind. So a few things that we're doing. We are very fortunate to be in the backyard of Epic, the software company. We're fortunate to use Epic software along with the community standard, and we'll be moving to the Epic Wisdom, which is their cute name, for their dental software. And that's just something that we think will be excellent, a really fully integrated product and something that will help us to provide even better care to our patients. We're also working again on telemedicine and how we move to a platform that can be maintained over time, and also thinking about it being accessible for people. And telephonic continues to be really important for the communities that we serve. Dodgeville Dental Clinic, where we've been for over a decade, we're looking at making a significant investment there of being able to increase our capacity, but also making sure that that's an excellent site for us to provide care for the foreseeable future. And on the job training, I think this is another of the innovations that we have found where there have been challenges with the workforce. Sometimes we haven't been able to find the people that we need. We've really innovated to find ways to hire people from the communities that we serve and to create career tracks for people to do the work that needs to be done, but also to help them to continue to have a viable career over time, which is very important. And so if we just move forward, and I want to make sure we wrap this up so you hear from other folks, but I just wanted to leave you with, I think you've heard a consistent theme from our health centers around mental health. And that's a big part of what Access does as well. We have an integrated behavioral health program, which means that we work, our behavioral health team works and is embedded in our medical clinics. We have a warm handoff from our medical providers to behavioral health. And that's such an important part of reducing stigma and really making sure that people are getting the care that they need on time, and that it happens in a way that their medical provider also knows about what's happening with the patients. Those are efforts that we're continuing to work on because we know that during the pandemic, behavioral health needs have only been exacerbated. And so we're pleased to be here. We're humbled. And again, we thank you for your leadership in serving our state.
Thank you so much, Joanne. We're going to move along to Gerald L. Ignace. So Jeremiah, you're up, and we have 15 minutes left with 3 health centers to present. So I'm going to hold you to that 5 minutes. Thanks so much, Jeremiah.
I'm Jeremiah Wayman, the Director of Marketing and Communications for the Gerald L. Ignace Indian Health Center. I will say, bear with me, I may be a little out of it this morning. I got my second dose of the vaccine yesterday, and it definitely hits a little harder than the first dose, at least in my case. But as Rochelle mentioned in the intro, the Gerald L. Ignace Indian Health Center was born out of the awareness in the 1970s of poor healthcare within Milwaukee's Native American community. Since its inception, we have changed names, changed locations, but our goal of improving the health, peace, and well-being of urban Indians in the greater Milwaukee area has steadfast. Like I said, we have grown. We have in that time we have tripled in size. We have now as a AAAHC and NCQA certified as a patient center medical home. We offer medical care, behavioral health, telehealth, dental, pharmacy, physical therapy, and then also our health promotion and disease prevention team, which kind of is an umbrella over a few things. We have a native wellness garden, a diabetic program, and also a wolf program that is an outreach program to our elders, providing healthy meals on a weekly basis that has that we've actually been able to continue via drop-off or pickup service during this pandemic. Next slide, please. Under what we like to call our All Nations Wellness Center, we offer a variety of programming specific to kind of different areas of our patient population. We have our youth empowerment program for kind of teen to younger age groups. We have our Circles of Strength program, which is a domestic violence centered program. Our Native Connections MKE, which really just started in this past year, is our suicide awareness program. Warriors of Tradition and Culture program is more like it says, focused on Native American culture. That has, I would say, taken a bit of a hit due to COVID, as those tend to be more in-person interactions and get-togethers. But we've had to kind of pivot, as everybody has, to try and find creative ways that we can still offer that aspect of our services. The Wolf program, as I mentioned, has been phenomenal as far as getting healthy meals and physical activity out to our elder population, which in the Native culture is a very important part of just the culture itself and the history. And as I mentioned, the health promotion and disease prevention program has kind of grown into developing just services around throughout the summer. They provided as long as with our Native Wellness Garden, provided food and in assistance with the Hunger Task Force. We were able to provide food on a weekly basis to our patient population. As far as this past year, everyone dealing with COVID and the pandemic, we have tested roughly, I believe, 2,500 tests over the past year, and as of recently have started vaccinating. As of yesterday, we finished we've completed our cycle of our employees, which was 50 employees, and then we have started vaccinating the kind of elderly population, beginning at 70 plus, and now we're kind of working our way into the 60 plus population. Overall, our patient population on a yearly basis is roughly 2,500 to 3,000 established patients, 50% of those being Native. So thank you again for being with us here today, and thank you for having me.
Thank you so much, Jeremiah. Next up, we have Stephanie Bishop from North Lakes. Stephanie?
Morning, I'm Stephanie and I work at North Lakes Community Clinic in Lakewood. We have a big service area that we serve. If you can see from our map, it's quite a large area. If you go on the west side, you have Turtle Lake. The east side, we have Oconto, and then just kind of go north, and that's the majority of our service area. Our community health center is governed by 93% consumers of our clinic. So their job is to ensure that the clinic is responsive to the needs of the communities that we serve. And in 2020, our population, we served our providers served 21,000 patients, and we employ 350 in our community, or 350 throughout our area. So that's the patients are via office visits, schools, and virtual visits is when they saw them. Our vision is just to lead healthy, prosperous lives and have engaged communities where everyone thrives. Slide 2, please. This is our community outreach. So we have a Superior Smiles program that brings preventive dental care right to where the people are. This helps reduce barriers to care for families. During the 2019 and 2020 school year, our dental teams saw over 16,000 patients in schools, children in schools. And then we have our school-based behavioral health program. This helps families experience many benefits from this option. By having this school-based behavioral health, they have improved access. It reduces travel time to and from the appointments. Parents are able to remain right at work and earn income so they don't have to leave to get their kids to those appointments. And those students are able to apply those newly learned skills right away when they're in school. So for the 2019 and 2020 school year, our behavioral health therapists saw 361 patients, and they had 3,307 visits. So that's quite a lot of visits for those kids. Next slide, please. These are the services that we offer. We're up to 7 sites that offer the chiropractic care. It's a natural form of health care and that treats the problems and not the symptoms. So we feel that's a very good benefit to help people with. Our health and wellness support staff, they connect the patients with both social and health services and actively remove barriers to care by providing those quality and integrative services to as many as possible. Whether it's health insurance enrollment, connecting sliding fee, housing, farm to patient, case management. In 2020, they saw over 2,476 people for those non-billable services. So that's quite a lot of people that they helped. We offer pediatric therapies. So we have speech therapy that is done at 1 of our sites and occupational therapy is done at 3 of our sites. We do have pharmacies in 3 sites, but they're closed pharmacies, meaning that we can only fill scripts written by our providers. Our psychiatry team that we have assesses and diagnoses mental health problems. They provide therapy, help develop and manage a treatment plan, which usually includes prescribing meds, and they're located out of our Hayward site. Then we have a recovery addiction program. Over the years, our addiction program has expanded with the help of grants targeting opioid use. Those funds were used to build a comprehensive addiction treatment program that addresses all substances within the recovery program. So our recovery program is focused on the whole human being and are assessed on each individual needs, which include medical care, mental health, counseling, group therapy, motivation, and overcoming other barriers to care. Our staff helps remove some of those barriers. So we work with quite a few different people to remove those. Sometimes we'll help with transportation to the clinic, daycare for parents during therapy. Sometimes we even do job placements. So we have a big team that helps. There's been behavioral health, community health workers, peer support specialists. They all work together to help those patients. We met the needs of the community this year by providing the COVID testing, and we've started vaccinating. We should be starting with patients this week and next week. So we're working with other community partners to make sure those vaccines get into people's arms. And the list is growing. Next slide. Thank you. Farm to patient. Our farm to patient program is very unique. It connects North Lakes patients to fresh and local farms. So sometimes patient providers can prescribe a box. A box can be prescribed by a provider if they think it's beneficial to the family. If they need it, this could remove financial barriers if they can't afford fresh foods and vegetables. They just need to commit to picking it up on a regularly set time and place, and they need to be a North Lakes patient. So that's a unique thing that we offer. And it's just to help improve their health and wellness. Our last slide then is Dave. Meet Dave. This is our golden retriever that is located in our Turtle Lake office. Dave helps relax patients during dental procedures. He also sits in on many behavioral health procedures and appointments, and he just makes people more comfortable. He's a wonderful stress reliever for staff and our patients, and they enjoy having him around. So I think every site would love to have a Dave at their site. But please reach out if you need anything from us, and we are more than willing to help in any way. Thank you.
Thank you so much, Stephanie. And we will wrap up this morning with Sarah Francois from Progressive. Sarah?
Good morning. Being brief is not always my strong suit, so I will try to go fast. Sarah Francois, Director of Fund Development and Marketing at Progressive Community Health Centers in Milwaukee. I've been with the organization almost 13 years, and in that time, we've more than doubled our patient population and our service sites. So you can see our locations here on the screen. We serve primarily the near west side and northwest sides of the city. Our main clinic is on 35th in Lisbon, but we also have a very unique urgent care model, actually located inside of Aurora Sinai Medical Center in downtown Milwaukee. We were approached by Advocate Aurora. Well, we've been there almost 5 years now. They were seeing a lot of patients coming in. Their emergency department was essentially getting overrun with uninsured patients, Medicaid patients, those patients who were going to the ED for primary care needs. They approached us about developing a partnership to divert those non-emergent issues into our urgent care, and it has been very, very successful. Just to be clear, we don't have any formal affiliation with them. We actually lease that space. So our urgent care is located right next to the emergency room inside of Sinai there. All told, we serve about 15,000 patients a year. Demographic wise, in terms of income, we're very similar to other sites across the state. About 85% of our patient population is African American, although we are starting to see a larger refugee population coming in, specifically Karen speaking patients, and also Hmong. So we have expanded services for those populations specifically. Also, we have the only mammography screening unit in all of the 53208 zip code, which is one of the hardest hit in the state of Wisconsin for death disparities related to breast cancer. So that is something that we're very proud of as well. Next slide. So I like to call this slide current events. Everybody's kind of talked about all their COVID testing and everything else. We have also done COVID testing. I think the most unique thing we've done as an organization, we actually have a very robust dental practice, especially at our Lisbon Avenue site. And we have been open for walk-in dental emergencies since the beginning of the pandemic on a daily basis. So we open up slots to anybody in the community. You do not have to be a current patient. And this was especially important as preventive dental services were largely shut down for many months as the pandemic has started. This became such a popular service that we've actually kept it running, even as we have gotten back up to normal services at our clinic sites. And I will also just note, as part of this, I know this is specific to our site, but I know many sites, you know, we are back up to over 95% capacity at our sites. Our patients are wanting to come into the clinics for care. And so it's very important that we continue to make these services available to folks in a safe way. And that's something that we've been very proud of. We've also did some drive-through flu shot clinics. All of our testing has been drive-through. So we've been very excited about that. Next slide. These are just some highlights of special programs. Again, a lot of them similar to other things that people are doing across the state. Our Stork's Nest program, it's essentially an incentive-based education program. We serve about 250 prenatal patients a year. We do all of our baby deliveries at Aurora Sinai downtown. But as people come in for their prenatal care appointments, they earn points, and they are able to then exchange those points for items in our Stork's Nest closet, which is really nice. I had to throw Evan Goyke in there, Representative Goyke. He actually is a former board member and a patient at our clinic. And we do have a Reach Out and Read program, which is an early childhood literacy program. And then our medical dental integration program kind of took over for our Seal a Smile program. So a lot of people have mentioned school-based services. We actually then brought those in-house. We do normally do school-based services at MPS, Milwaukee Public Schools, but we brought that more in-house. So now we actually have dental hygienists that are on the clinic floors in our pediatric departments. We are also one of the few sites in the state that has a pediatric dentist on staff. So that's another super important service that we offer. I will just say kind of, you know, I have the honor of sort of closing things out. We've heard from a lot of great people and organizations. And one of the questions we always get as community health centers is, why are there so many of you in the state? And I think it's just really important to know, you heard from 3, even just in Milwaukee. We all serve different populations. We all serve different neighborhoods. And we staff our clinics from those neighborhoods as well. We know our communities really, really well. And so we're able to tailor all of our programs and services to what our communities specifically need, which is why funding is so important, and partnerships with the state is so important. And whether it's the state CHC grant or other programs that we're looking to fund, we are really, really good stewards of this money. And we are really proud of the programs that we have brought, especially during these COVID times and other things. I think the greatest thing you can hear about community health centers is we are innovative. We are always willing to jump in and do things when we need to, but we are also very, very willing to work together. So appreciate you taking some time. And I'm sure I'll hand it back over to Rochelle to officially close things out, but.
Thank you so much, Sarah. Appreciate hearing from all the health centers today. We don't have time for questions, but we'll send this deck out and I'll reach out to all attendees directly to see if there's anything we can help you with. We just want you to know that health centers are a resource for you all, for staff, and for patients. So if you hear from, someone in district who's having trouble getting primary care or can't find a dentist, we are happy to help and see what health centers might be available and what services they provide. Sarah did a wonderful job of noting the Community Health Center grant that's available for co-sponsorship now. Just want to make that plug since it just popped this week. So we're pretty excited about that, and you'll be hearing more from me about that as well. So we really appreciate all of your time today. We'll send these follow-ups, and thank you so much for joining us. Have a wonderful Friday. Thanks, folks.